The Ministry of Health says it is committed to ensuring the availability of all vital, essential and non-vital drugs in the country. This was said by the Minister for Health, Sibongile Simelane, during a press conference at the Cabinet offices. The Ministry of Health has corrected the statement reported on Monday that the country has been hit by another drug crisis. The Minister of Health, Sibongile Simelane, speaking during a press conference, said the ministry would like to bring it to the attention of the public of the Swazi nation that it is committed to ensuring the availability of drugs in the country. The minister says, according to the Prince Sigelela report, there are 3 activities that they were to implement.
One was to make sure that we improve the availability of the drugs by making sure that we have got a system in place which will be able to see whether we do have drugs or not. And the other one was also to make sure that we have in each health facility a committee responsible to discuss and also to make sure that we have got enough drugs in our different facilities. And the last one was also to review the standard treatment guidelines. And yesterday, through the Office of the Chief Pharmacist, we shared as a ministry to say how far are we to make sure that our clients would know whether they have to go to the different health facilities, and when they go there, are they going to get the drugs.
Chief Pharmacist Fortunate Bambe reiterated that the country is not faced with a drug crisis.
The Ministry of Health has adequate stocks of medicines that are required for the general public. As a ministry, we categorize our medicines into 3 categories. That's a system which we call the Venn analysis. The V stands for vital. Those are vital medicines that have to be in place most of the time. And whenever we are out of stock of vital medicines, emergency procurement measures are put in place to correct that anomaly in an expedited manner. And then we have essential medicines that are needed again by the general population, but those are interchangeable. In the event one is not in stock, we can always substitute it with another within the same class, and we make sure that we avail the needed medicines to the population. The last class is the non-essentials. We also do work hard to make sure that we do have the non-essentials, but those are what we call the nice-to-have medicines. But no vitality can result as a result of not having a non-essential medicine in stock.
The Director of Health Services, Dr. Vusimakakula, said another issue that appeared in the Prince Sigelela report is that of human resource in the health facilities.
There is one university in which there are some graduates who will be graduating before long, and they are ready to be employed. So we will be deploying them in the facilities. And it is important to note that this is the first time that some of the facilities will be having pharmaceutical personnel who are trained and they know very well what to do about that.
The ministry gave assurance to the nation that the country is not faced with a drug crisis as reported. Reporting for Swazi TV News, I'm Sibusiso Ngubane in Mbabane.